Hi everyone, hope I'm audible and visible. And welcome to the session on Biochemistry Recall of INI-CET November 2024 paper. And let me start the session with a disclaimer. The questions discussed in this PowerPoint are recall based, and the motto of this live session is to get the actual question during this discussion. The final question received after discussion will be uploaded on the PrepLadder app. So this is Dr. Shanmugapriya, your PrepLadder faculty for Biochemistry. And about today's paper, can I know on the chat box, what is your review about the paper? Was it a typical INI-CET paper or did you find it to be atypical? All good. Thanks, Anuj Sharma. So how was the paper? I would say it's an atypical paper. Reason being, recently, in all biochemistry part of any of the exams, we have been seeing questions on glycogen storage disorders, on glycosphingolipidosis. But this time we had no questions on all these most commonly asked topics, right? Totally, I found 15 biochemistry questions in this paper, out of which 4 were clinical biochemistry. When I say clinical biochemistry, it's about lab part of biochemistry. They had asked 2 questions on blood collection tubes. And then 1 was on pancreatitis diagnosis, right? And then 1 more question on clinical biochemistry, which was related to serum calcium estimation. So I would say this is a totally different paper when compared to what I have observed so far. And genetics, there were 3 questions, and all those 3 questions were moderate. I would not say it was very difficult to answer, right? So this is my understanding of how the paper was today. And let's start the discussion. This is the first question that I would like to discuss about, because the very simple question, straightforward one-liner kind of question, match the following amino acids with derivatives. So what is the right answer? Histidine, we know, gives rise to histamine. Tyrosine gives rise to neurotransmitters, including catecholamines. Tryptophan gives rise to serotonin and melatonin. Cysteine is the part of a tripeptide, which is glutathione, right? We have discussed about glutathione in detail. I said it is gamma glutamine cysteine glycine. It has got cysteine. So what is the right answer? 1 has to be paired with B. 2 has to be paired with A. So the right choice here is A. I hope all of you answered it right. Yeah, this we discussed even in the LRR session, right? All specialized products that you get from all amino acids. So answer for this question is choice A. The next question, which of the following is used in diagnosing aneuploidy? So this also we discussed in detail in LRR session, wherein I told you there are 2 types of molecular diagnostic techniques. I won't say it's molecular diagnostics. As far as genetics testing is concerned, there are 2 types. One is molecular diagnostics, which is detecting a disorder at the molecular level. And the other one is cytogenetics, wherein we try to understand chromosomal aberrations. When you say aneuploidy, it is chromosomal aberration, copy number variations. And for that, I said you should start with the basic testing, right? Basic testing is karyotyping. So karyotyping is the basic cytogenetic technique, which can be used to detect chromosomal aberrations. And then FISH is an improvised technique that can also detect aneuploidy. Sanger sequencing. So we have next generation sequences, which can sequence parallelly all chromosomes and will detect how many chromosome copies for every pair is detected. Okay. So Sanger sequencing can also be used to detect aneuploidy. And we also have PCR. We have something called as digital PCR, which can be used for prenatal assessment of aneuploidy, right? When I say prenatal assessment, we collect maternal blood sample. From maternal blood sample, we collect cell-free DNA. So cell-free DNA of the fetus will be floating in the maternal blood sample. That is extracted and that is subjected to digital PCR to find out if there is aneuploidy. So what is the right answer for this question? For aneuploidy detection, all 4 can be used. Cytogenetics, karyotyping, FISH, Sanger sequencing, PCR, all these can be used. Thank you, Nitesh. I'm very happy that you got 206 score. So the answer here is 1, 2, 3, 4. FISH was not in the choice. Yeah, I think it was given as in situ hybridization. Right? What is in situ hybridization? It is fluorescent in situ hybridization. That is why learning abbreviation is important. That is nothing but Fish Utkarsh Sharma. Answer is choice D. Enzymes used in recombinant DNA technology are. Let me tell you the answer first. I know you're all anxious to know the answer, and then I'll give you an explanation. The answer for this question is isomerase. Isomerase is not used for recombinant DNA technology because isomerase is something which is related to chemical structures. Okay, we are not going to use it for a genetic testing. So in recombinant DNA technology, as the name indicates, what we do is we combine two unrelated genomes. And for combining two unrelated genomes, we need enzymes like terminal transferase and phosphatase. Because as I've already explained you, in recombinant DNA technology, we use restriction endonucleases to cut both the vector as well as the gene fragment. After you cut it, suppose you're using a blunt end producing restriction endonuclease, terminal transferase will attach few nucleotides to get overhanging edges, because only then you can ligate to unrelated genomes. That is why you use terminal transferase. Phosphatase is also used whenever there is excess overhanging edge. So these two are always used in recombinant DNA technology. CRISPR-Cas enzyme system is a modified version of recombinant DNA technology wherein we use this enzyme for gene editing. And for gene editing, you have to insert CRISPR sequences and you have to insert Cas gene sequences. How do you insert CRISPR and Cas gene sequences? By recombinant DNA technology. So we use phosphatase transferase, we use CRISPR-Cas9 in recombinant DNA technology. What is not used is isomerase. Okay. Answer is 2, 3, and 4. Which of the following does not inhibit cytochrome? So we have electron transport chain complexes, wherein complex 4 is cytochrome A and A3. And this complex 4 or cytochrome A and A3 are inhibited by common poisons like hydrogen sulfide, cyanide, and carbon monoxide. So what is the right answer? Very good, Alam. The answer is nitric oxide. Okay, so nitric oxide is not an electron transport chain inhibitor. Good. The next one, ATP is not required for which of the following transport mechanisms? I've explained about transport mechanism in our in all videos, right? So the basic question here is, which of the following is the passive diffusion mechanism? Only active transport mechanisms are dependent on ATP. Passive diffusion mechanisms do not need ATP. So the answer here obviously is simple passive diffusion and facilitated passive diffusion do not need ATP. Paracellular transport is also a passive diffusion mechanism, most commonly driven by chemical gradient or by electrical gradient. So 1, 2, and 3 do not need ATP. Cytochrome C was specifically mentioned. Anyway, nitric oxide does not inhibit any of the electron transport chain complexes. Okay. So the answer here is which of the following does not need ATP, which means it is 1, 2, and 3. Okay, choice B. A diabetic patient. Yeah, I like this question a lot. This looks like a complex question. They're asking you, why do you see high VLDL in a diabetic patient? Even if you don't know this part, we have discussed that in diabetes, there is low insulin. And low insulin, what did we discuss about insulin's effect on hormone-sensitive lipase? I told you insulin inhibits hormone-sensitive lipase because hormone-sensitive lipase is a catabolic enzyme. And insulin stimulates lipoprotein lipase. So whenever there is diabetes, there is low insulin. What will be the impact of low insulin? Low insulin causes a high hormone-sensitive lipase activity. What will happen when there is high hormone-sensitive lipase activity? There will be excessive peripheral lipolysis. So all fat will be pushed from the adipose tissue to reach the liver. After they all reach the liver, from liver it will be coming out as VLDL. So excess VLDL is formed. But we also know insulin stimulates lipoprotein lipase. So in a diabetic individual, there is low lipoprotein lipase activity. Without lipoprotein lipase, VLDL will not be metabolized. So there is increase in the rate of VLDL synthesis and decrease in the rate of VLDL catabolism. Put together, that is responsible for high VLDL levels in a diabetic individual. That is responsible for hypertriglyceridemia. So in a diabetic individual, there is excessive peripheral lipolysis and low VLDL catabolism. Are you clear? So what is the right answer here? The right answer here is high hormone sensitive lipase and low lipoprotein lipase. We have learned this as insulin hates, right? Insulin hates hormone sensitive lipase. Insulin loves lipoprotein lipase. So in diabetes, there is high hormone sensitive lipase and low lipoprotein lipase. Okay. So answer is choice A. Which amino acid donates nitrogen to sodium benzoate? Have we discussed this? I explained about this so many times when we discussed about glycine metabolism, right? I said whenever you see a child presenting with hyperammonemia, to reduce serum ammonia levels, you can start IV sodium benzoate because sodium benzoate will be conjugated with glycine to form hippuric acid. So this reduces glycine availability. To form glycine, what will be used? Ammonia will be used. So what is the right answer? Glycine. Anuj Sharma, answer for this is glycine. Because whenever you see a patient with hyperammonemia, you start IV sodium benzoate. Liver will conjugate sodium benzoate with glycine, converting it into hippuric acid. So the body will try to generate more and more glycine. From where do we get glycine? Precursor for glycine is ammonia. So ammonia gets used up. So from where do you get the nitrogen here? We get the nitrogen from glycine. Answer is choice C. Good. The tube used for serum electrolyte estimation. We have learnt about blood collection tubes in detail, wherein I told you electrolyte estimation, which is done in biochemical laboratory. For all biochemical laboratories, we are going to use which sample? A red topped tube, right? But if the sample has to be stored or if the sample has to be transported, then it has to be collected in a gel tube. And gel tube has got what cap? Yellow cap. So for serum electrolyte estimation, it is either red top tube, but if the sample has to be transported or stored, it has to be yellow top tube. Yes, Utkarsh Sharma, peripheral insulin resistance or it is diabetes, it would mean the same. When there is insulin resistance, what will happen? Hormone sensitive lipase will be hyperactive. The answer remains the same. Okay. So the answer here is yellow. Electrolyte estimation, you have to collect blood sample in an yellow tube. Why not lavender tube? Lavender tube has K2 or K3 EDTA. If you're using that for electrolyte estimation, there will be false elevation of potassium. Why not green? If you use green, it's a plasma sample. It's a heparinized tube. Have we learnt about this? Green top tube is a heparinized tube. There is a possibility that it is a sodium heparin tube, which will cause false elevation of sodium. So that's also not preferred. If it's a whole blood sample, then probably you can use green tube, but they have asked you serum electrolyte estimation. So it's not a green top tube. Gray. What does gray top tube have? Sodium fluoride and potassium oxalate. So both these will cause high sodium and high potassium. So all these should be avoided for electrolyte estimation. It has to be yellow topped tube. Okay, answer is choice A. Another question on blood collection tube again, right? So which anticoagulant is ideal for blood sample for HbA1c estimation? This also we have discussed in detail. Have I told you that for HbA1c estimation, you need a whole blood sample? Whenever you need a whole blood sample, you should not allow the blood to clot. So there should be an anticoagulant. And the anticoagulant that is used is EDTA tube, right? So the lavender top tube or EDTA tube is used for complete blood count, HbA1c estimation, labile parameters like parathormone, ACTH and ammonia. So for HbA1c, it's an EDTA tube. Answer is choice A. True regarding pancreatitis is. One more interesting question, right? As far as clinical biochemistry is concerned, you need to know what is the significance of every parameter that you estimate. For pancreatitis, we have lipase, we have amylase. So what is the difference between these two parameters? Obviously, lipase is more specific. We know that, right? Lipase is more specific because amylase estimation can be observed even in salivary gland tumors or even in gastric perforation or in renal failure. So which is more specific, all of you? Lipase is more specific. So answer for this question is choice C. About other choices, both lipase and amylase do not indicate severity of pancreatitis. Even with the mild inflammation of pancreas, we have seen massive elevation of amylase and massive elevation of lipase. So severity of pancreatitis should be understood by combining both biochemical features, CT findings, and clinical features, right? We have various criteria to define the severity of pancreatitis. These parameters do not tell you anything about that. And amylase level will come back to baseline level in just 2 days. It does not remain high for 30 days. It comes back to baseline in just 2 days. So the answer here is lipase is more specific than amylase. Okay, good, all of you. Very good. Which of the following is true regarding serum calcium estimation? Did you all see this question? What is the right answer that you chose? For serum calcium estimation, clenching the fist is to be avoided, right? You should not ask the person to clench the fist or you should not ask the person to exercise. When you ask the person to do all this, there will be acidic pH. And acidic pH will cause false elevation of serum calcium. Similarly, tourniquet application for more than 60 seconds. That will cause false elevation of both total calcium and ionized calcium. So both these have to be avoided. Obviously, citrate and oxalate tubes should be avoided because citrate and oxalate will chelate calcium, causing falsely low values. So what is the right answer? Prolonged immobilization causes increased free and total calcium, because what will happen when there is prolonged immobilization? There can be osteoporosis, right? Bone resorption, causing elevation of both serum, free and total calcium. So answer here is choice C. So what are the facts that you have learned about serum calcium estimation? Don't ask your patient to clench the fist. Don't ask your patient to do some exercise. Don't apply tourniquet for more than 60 seconds. Okay. Deficiency of copper, which is necessary for lysyl oxidase, is seen in. Copper deficiency disorder is Menkes disease. Have we discussed about that? ATP7A mutation causes Menkes disease. 7A helps in increasing copper absorption along the intestine. So there will be copper deficiency, which causes kinky hair and fractures, both because lysyl oxidase is not active. So answer is Menkes disease. In diabetes, because of insulin resistance, shouldn't we have hyperinsulinemia? Aman, high insulin does not mean anything. Only when insulin is working, there is some effect, right? High insulin does not mean high insulin's activity. All that you have to know about is how much insulin is going to go and inhibit hormone-sensitive lipase. How much insulin is going to go and stimulate lipoprotein lipase. Do you all understand that? So answer is Menkes disease. Which is an essential fatty acid? So do you see two right answers here? There are two essential fatty acids. One is linoleic acid. The other one is linolenic acid. Given a choice, go for linoleic acid. Because linolenic acid, we have two linolenic acids, alpha linolenic acid and gamma linolenic acid. Only alpha linolenic acid is nutritionally essential. So if it's a multiple right answer type MCQ, which was asked in INI-CET, then the right answer would be A and B. But if you're asked to choose only one, it is choice A, which is linoleic acid. This was not there. Okay, then let's skip this because I was told by a student that there was a question on essential fatty acid. No, let's skip it. But if it's asked, the right answer would be linoleic acid. Okay. So a good question, right? It's like a one-liner. So another atypical feature of INI-CET November 2024 is I saw many one-liners. So sickle cell anemia is caused by which of the following changes? In sickle cell anemia, there is a mutation of the 6th codon, wherein 6th codon, instead of coding for a polar amino acid, which is glutamic acid, starts coding for a non-polar amino acid, which is valine. So what is the right answer? Glutamic acid to valine. Answer is choice D. Okay. Which of the following is not a high anion gap metabolic acidosis? This also we have discussed so many times, right? So metabolic acidosis can be either because of production of an abnormal acid, or it can be because of loss of bicarbonate. Whenever it is because of production of an abnormal acid, anion gap will be high. What are the abnormal acids that can be produced? Let me tell you the answer first. The answer here is choice C, diarrhea. Diarrhea causes normal anion gap metabolic acidosis. Because in all other conditions, ketoacidosis, keto acids accumulate, that will increase anion gap. Renal failure, all metabolic acids accumulate. All these increase in metabolic acids will increase anion gap. And inborn errors of metabolism, they are associated with lactic acidosis. Lactic acid becomes lactate anion, and that increases anion gap. So diabetic ketoacidosis, renal failure, and inborn errors of metabolism, all these cause high anion gap metabolic acidosis. Whereas in diarrhea, wherein you're losing bicarbonate through stools, your body compensates by reclaiming chloride. So the anion gap will remain normal. Okay, answer is choice C. So these are the 15 MCQs that were asked in INI-CET November 2024. I hope you all know and understood the answer for all these questions. They gave only glutamic acid to valine. That is what I was told. Glutamic acid to valine was there in the choice. I was told that there was no confusion about this question. Okay, so answer here is choice C. Do you have any other questions in biochemistry that was asked in INI-CET November 2024? If you want any further clarifications, please type it in the chat box. Maybe they gave it like this. Was it like this? Or some notation could have been different, which could have confused you, because this is the only variation that can cause sickle cell anemia, nothing else. If it's not given, then the question is not right. Okay. If you have any more questions, please type it in the chat box. Otherwise, my best wishes to all of you. Yeah. Copper deficiency mentioned, dietary deficiency. So how is it Menkes disease? Was there anything related to lysyl oxidase, Subhashini? Because Menkes disease, most of the clinical features of Menkes disease are attributed to low activity of lysyl oxidase. Whereas if it's dietary copper deficiency, it starts with tyrosinase being inactive. And that is why they present with hypopigmentation first. Dietary copper deficiency presents with hypopigmentation. Then they present with anemia. Then they present with neutropenia. And we don't see many of the manifestations of lysyl oxidase becoming inactive in dietary copper deficiency. So if they had given lysyl oxidase in the question, then I would go for Menkes disease. Okay. Is that clear, all of you? Collagen linkage was weak, then it is Menkes disease, Kushi Singla. So see you all. So you have done your part, you have written your exam, so no more anxiety, relax today, have fun, right? So that you can get ready for the next part of your life. Yeah, see you soon.